Starting correctly. Whenever you approach a patient at their bedside in the OSCE, it's very important that you follow some key steps and verbalize everything as you go. You may want to remember the acronym SPINH-PAPSR to help you recall the steps to follow whenever approaching a patient. S for safety. As you approach the patient, verbalize that the area is safe to approach and that there are no wires, obstacles, or spillages causing a safety hazard. If there is a hazard, put it right straight away.
As I enter the area, I check for scene safety and I can confirm that the scene is safe for me and my patient.
P for privacy.
I draw back the curtains to provide some privacy.
I for infection control. Before starting the assessment of the patient, wash your hands using the Aycliffe 7 step technique. Remember, in the OSCE, it's fine to use hand gel for this step.
My patient, and now proceed with the 7 steps on hand hygiene. Now that I'm clean, I'm ready to approach my patient.
This does not have to be verbalized in the OSCE, but it can be a helpful memory tool. N for names. Introduce yourself to the patient by your name role and also ask the patient their preferred name. Effective communication is really important in the OSCE, so be sure to maintain eye contact and focus on building a rapport with the patient. To save time, you can also ask them their date of birth. Depending on the situation, this may be an appropriate time to ask the patient why they're being treated today.
Hi, my name is Breacher and I'll be your nurse for today. May I know your preferred name?
Yeah, it's Sai.
Alright, Sai. Do you know why you're here in the hospital?
I'm not sure actually.
Well, you've had a bit of a fall from some ladders back at home and bumped your head, so we just want to make sure you are okay.
Okay.
Is that okay?
H for hear and see. It's important to check as part of your introduction that the patient can hear and see you okay, particularly if their patient overview document highlighted the patient had hearing or communication issues. If they need their glasses or hearing aid to communicate with you effectively, this should be addressed when you first speak with them.
Now I'm wearing protective gear and a mask. I'd just like to ask if you can hear me okay.
I can, yeah.
Thank you. Now, I saw in your notes that you have a hearing aid. Do you have it now?
Yeah, I wear one in my right ear. So we speak into that one.
Thank you.
P for perform an ID check. Before you go any further in the assessment process, it's really important that you perform an ID check so you know for sure that you've got the right patient. Once the patient has introduced themselves to you, make sure that you check the name against their paperwork and also their wristband. This is a 3-way ID check.
So I'd just like to do a quick ID check on you together with the wristband you have, if that's okay. May I know your full name and date of birth, please?
Yeah, Simon Conrad Waller, 3rd of January 1976.
Okay, the details I have here are for Simon Conrad Waller, 3rd of January 1976. Hospital number is 87601521. I can confirm that the detail match, so I am with the right patient.
Remember, if you are in a community setting, the patient won't have a wristband, so instead ask the patient to tell you their full address, as well as their name, and check this against your paperwork.
Then, so before we start, can I ask for a quick ID check?
Yes.
Okay, so can you state your full name, your date of birth, and your full address, please?
Yeah, it's Christine Pullman, and it's the 8th of October 1964. I live at 42A Steppingley Road, Flitwick, MK 41 78E.
Okay, so do you have any photo ID with your full address and your date of birth and your full name as well?
No, I don't think so.
Okay, that's fine. So I'm just going to check on that with the paperwork, okay?
Yeah.
So I can see that is correct.
A for allergies. At this stage, you'll need to check if the patient has any allergies. You can do this by asking the patient if they have any allergies and also by checking to see if they have an allergy band on their wrist. However, remember in the OSCE, they may be testing you on this. The patient may not have an allergy band or the details could be incorrect, so pay close attention. A good way to remember what allergies to ask your patient about is FML: food, medicines, and latex, the most common allergies. Remember, if they do have an allergy, you must ask them what their reaction is.
Now, do you have any allergies?
Yeah, I'm allergic to penicillin.
And what happens if you take penicillin?
I get a rash all over my body, and I get diarrhea.
Okay, now we'll make sure you won't get that in your hospital stay, right? Can I check your red wristband real quick, right? So I can see that the details are correct, but I can't see any penicillin written on it, right? But don't worry, after my full assessment, I'll come back and have a new one with penicillin on it, okay?
In the OSCE, you don't have time to solve everything right away, like getting a new allergy band, but as long as you verbalize you know that there is a problem and say what you will do about it, the examiner will know it has been addressed. Even if in your orientation your OSCE test center tell you that they are a latex-free environment, it's still good practice to ask the question. P for pain and S for score. Once you've asked them about allergies, you want to find out if they have any pain. You can ask them if they're in any pain, and if so, where that pain is and how they would score it. Remember, how you assess pain could differ according to the scenario. For example, in pediatric patients, you might use visual cues to assess pain, whereas in patients with dementia or learning difficulties, the Bolton Pain Assessment tool may be more appropriate.
We've been told that you've been experiencing pain. So can you tell me where it is located?
Yeah, it's in my lower back area.
Okay.
Yeah.
So if you have to rate the pain, can you tell me the score between 0 to 10? 0 is the lowest and 10 is the highest.
I'd say now it's about a 2. But if I hadn't taken any painkillers, it would probably be a 4 or a 5.
I see.
You can record the patient's pain score in your notes to remind you if it helps. For example, you could note down PS4 for a pain score of 4. Remember, you will be using these notes in your next OSCE station, planning. If the patient is in pain at the assessment station, you should assess whether the pain needs to be addressed immediately. Thinking ahead, it may also be an indication that the patient may require an operation, and the patient might be post-operative in a later OSCE scenario that you receive. If the patient is in pain at the assessment station, always demonstrate empathy and try to make them as comfortable as possible. Try non-pharmacological interventions first, such as repositioning.
Okay, would you like me to reposition you and make you feel more comfortable?
No, it's
You're
alright.
fine.
You can also ask them if they require any pain relief to assist with their pain.
You okay? So do you want any pain reliever right now?
Oh, no, I'm fine at the moment, thank you.
Okay.
It would be unusual in the OSCE if the patient does want some immediate pain relief. If this happens, you could tell them that you will check their hospital notes to see if they have any due medications. And if they don't, you will speak to the doctor to prescribe one. You must then check with your assessor that the patient's pain has been resolved and it is okay to proceed with your assessment. It would be inappropriate to carry out the observations if the patient was in a lot of pain and required immediate pain relief. R. Rapport. Because good rapport and effective communication is so important in the OSCE, and to provide you with some additional information about the patient's situation, make general conversation with the patient about what brought them into the hospital, or the reason for your visit if you are in a community scenario. It's important that the patient knows the reason they have been admitted to the hospital in order to engage them in their care.
Hi, my name is Maverick. I'll be your nurse for today. Can I ask for your preferred name?
Mona is fine.
And Mona, what brings you to the hospital?
I've been feeling quite breathless, like I can't get enough air in. I think I might be at risk of COVID-19.
I'm so sorry to hear that, Mona.
At this point, you can acknowledge and demonstrate empathy for the way the patient is feeling. If there's anything you can do at this point to help them, then you can provide them an immediate solution. But don't feel like you have to solve all of the patient's problems immediately.
Now, before I go, is there anything else that is bothering you?
To be honest, I'm a little bit worried about my daughter. She's at home, she's 19, and she's got Down syndrome. But she's not very good on her own, because she's got a mental age of about 10, so I'm quite worried about her.
Oh, I'm sorry to hear that, Mona. Do you want me to call someone?
And my neighbour usually checks in on her, but obviously she can't at the moment with social distancing, so I don't really know what to do.
Well, if you want, I could refer your daughter to the social service for safeguarding. That way they could pay a visit to your house.
Yeah, that would be great, thank you.
Okay.
Remember, unless it's an urgent clinical issue, don't get sidetracked into trying to solve the problem straight away. These are the key steps you must follow anytime you meet a patient in the OSCE, not just at the assessment station, so we recommend you memorize them in the correct order. Spin PAPSA. After you've completed these key safety steps, there are a few other things to consider before you commence your observations. Explain the purpose of the visit. Tell the patient why you've come to see them, so you are involving them in their care. We know that patients who feel involved in their own care have better outcomes, and it's important to get consent from the patient to undertake the assessment.
So I am here to make you feel comfortable, but in order for me to do that, I need to do a full body assessment. Is that okay with you?
That's fine.
Deal with props. Look around to see if there are any props that need addressing immediately, either because the patient needs them straight away or because they are a safety hazard. For example, if there is a hearing aid or pair of glasses that the patient needs for the assessment. Look at the environment around you as an opportunity to gain more information about the patient.
You can see here that you have reading glasses. Are these yours?
Yeah, I just use them for reading.
So you don't need it now.
No, I'm fine.
Thank you.
Check patient is comfortable. Before you begin your assessment, there are a few different ways you can check that the patient is comfortable before you proceed. For example, asking them if they need the bathroom before you conduct the assessment, or if they require a positional change.
Okay, so before we begin, do you want to go to the bathroom for a while?
Oh no, I'm all right at the moment, thanks.
Okay then.
Once you've checked the patient is comfortable in this regard, you can begin your observations. However, remember that conducting this initial part of the assessment, you will likely have gathered some helpful information around how they are presenting. For example, are they breathless? Do they have a headache? Do they have pain? Are they anxious? This is all useful information for the next stage of the OSCE, which is care planning. So make sure you record your findings from this station in your notes to help remind you to address these issues when you write your care plan.